Healthcare and education are very fast-moving entities. We barely keep pace with the present without even being able to serve the future. My first few years as Director of Health Sciences at Dal were spent navigating COVID. At the same time, we were having lots of meetings with stakeholders, talking about human resource shortages in the imaging professions and respiratory therapy. We seemed to go around in circles as to who was actually collecting the data and what the real needs were. Fast forward to Christmas Eve, 2022, and I get a call through my earphones while I'm running, and it's a mandate from Nova Scotia Health to double the intake of 3 of our programs. My first thought was, how? And then that was followed by, I did not sign up for this. But as I began to process the gravity of it, I tried to rationalize it the same way I do with a lot of aspects of my life. I can't generally control what happens, but I need to choose how I react to it. So from the start of the process, I really tried to look at it as how do we turn this in our favor? There's no way we could double in size and do things the same way. We had to commit to doing things differently, and we had to think outside the box. That being said, it really hasn't been easy. If I focus on 2 things, or 2 challenges that we had, the first would be our simulation equipment, of which we had none. Everything we had was something the hospital threw away, so we needed to figure out where that was gonna come from. And we also needed to figure out where were we gonna put all these students clinically so they could learn. The equipment we'd struggled with for years. I'd knocked on a lot of doors, but nobody really wants to give you $4 million. And our programs are high tech. Everything is expensive, and all of the asks had been denied. But this was new. This was something we needed to make the growth work, and we couldn't do what we needed without the best equipment. So I diversified the ask. I went to various stakeholders, and I essentially asked each of them for just $1 million. And that seemed to work. We now have equipment that is as good, if not better, than the hospital. And so that's amazing for learning, and it kind of fueled the next idea. So the next project was to look at our clinical placements differently. We were already moving into a new space. We'd outgrown where we were, and we had a lot more square footage. So the idea started that we would create our own placements through student clinics. We would create teaching facilities that place our own students with real patients. We solve the placement issue for some of our students, additional students, and then we take Nova Scotia patients off already miles-long waiting lists. Has that been easy? No. Did everybody love our idea? Absolutely not. But we're piloting 2 clinics. One is for ultrasound, the other one is for lung health, specifically spirometry. At the onset, these clinics will take a couple of hundred patients a month off the wait list. By the time we get to a full summer practicum that's 10 weeks long, that number could be as high as 1,000. It seems like nothing but a good news story, but new ideas aren't always easy to implement. The ultrasound project had loads of buy-in from the department, and the wins were big for them. So for the most part, that one has gone really well. But our lung wellness clinic faced obstacles one after another. While I like to think that we all have the same goal, increase the number of healthcare professionals in the province and improve patient care, the start of opening these clinics has been kind of like a rugby game, where you're desperately trying to get the ball across those last few inches towards the line, but there's 4 people trying to tackle you. And the worst part was they were on my team. So our enthusiasm always seemed to be met with reasons why it wouldn't work. I've always been a big picture person, and it just needs to work. And more than once, someone has asked me, what do you know about running a clinic? My answer is nothing, but I'll figure it out. So I just need to put the right people around me. And with a shared vision of many of our partners, including one very patient one that is actually funding the first year of operation, we've been at this for 2 years because we know it's a good idea. We've faced the challenges head on, and we just refuse to fall down. We've had to re-renovate our space to meet infection control standards that the hospital doesn't currently meet. We've had challenges with coordinating staffing. And we definitely didn't make some people happy, but ultimately not everyone has to be. Most of the issues stemmed from being different, Different is hard and sometimes takes more work. And it doesn't fit with the model that everyone is used to and been following for years. But that model isn't working. And so while the school is used to working with some departments at Nova Scotia Health and also government, these projects also brought in a lot of outside partners. So at times, the rooms seemed very crowded. And over the past 2 years, we've had different levels of engagement, and we've had a whole lot of resistance. We've really had to apply pressure in order to get things in place. When we started to coordinate the logistics, the thought for our lung clinic was why we should probably take patients from the longest waiting list, which is over 2 years. That we thought was easy, until the physicians that controlled those waiting lists didn't like our idea. They told me it was their decision if they were going to share those lists with us. And I was a little shocked at the response, and certainly the rudeness to which it was delivered. And ultimately, you don't have to like the idea, but you should care about the fact that your patients are just getting sicker. So in reality, we have lots of other lists that we can draw from, and that's where we'll start. It is disheartening for sure, though, when you know that your idea is good, it's going to benefit learning, it will benefit patient care, and somebody just doesn't want to veer off that traditional path. I was incredibly frustrated because I think on top of my actual job, I'm renovating a building, I'm procuring equipment, and I'm trying to sell a new delivery model to some people that just don't want to listen. Thankfully, we've had some great partnerships that have formed throughout this process that also share the same vision. And that's made tackling the obstacles a little less isolating. This week we officially opened. And while we've got a long way to go, these ideas are just the beginning. We've got lots of ideas, and our plan is we will train more students and we will decrease patient waiting lists at the same time. Thank you.